Hi, I'm James. I'm a doctor working in the NHS and I'm currently taking time out of training to complete my PhD in medical education at the University of Oxford, having completed the academic foundation programme on the Cambridge rotation in 2017. In this video series, I'm going to outline key skills and day-to-day practical advice for new junior doctors, medical students who are coming towards the end of training, or those who, like myself, have had time out of training and want to refresh their knowledge before going back to clinical work. In today's video, we're going to cover how to write a strong and excellent discharge summary for a patient who's being discharged from your care back to the GP or family practitioner. This is a task that every junior doctor will have to complete, often multiple times a day. It's not fun, but it's important that you understand how to do it well. This video is going to cover three key areas. Number one, what is needed before you write the discharge letter. Number two, what to include in the document itself. And number three, what to do once the discharge letter has been written and completed. I'll then take you through a short worked example to illustrate how to do this in practice. Before you write the discharge letter, you should find out, is the patient definitely leaving and when are they expected to leave? This is going to help you prioritise when you need to write the letter. If it's a morning and the patient is leaving in the afternoon, you need to prioritise writing that letter and getting their medicines finalised in the morning prior to them leaving. Remember, it takes time for the pharmacy team to prep and get any discharge medicines, also known as TTOs, and also for the ward team to book anything like transport that the patient might need. Communication is key. Number two, if you use paper notes, make sure that you get all of those notes together before you start writing the letter. It's just going to make things so much easier for you. Number three, if you use a computer system, you should get some key documents together. These include the initial clerking. Why did the patient come in the first place? If the patient has been in the emergency department, often that doctor will write a short, brief letter to the GP as to why they came in. But if they've had a prolonged stay, it's really useful to refresh your knowledge as to why they came in. It's also good to look at some key events, so key ward round notes, occupational therapy notes, physiotherapy notes, scans or bloods, and we'll come on to that later. Number four, make sure the patient knows that they're leaving. If you've got time and get consent from the patient, offer to make a quick call to their next of kin, if they give consent, just to let them know they're being discharged. You don't always have time for this, however, and if you feel that the patient's capable of doing this themselves, let them do this. This is going to save time for you during an inevitably busy day. But sometimes it's a really helpful thing to do, especially for elderly patients. Now let's look at what you need to do when you're writing the actual discharge letter. My top tip is to make it short and concise. Remember, the GP is going to be really busy when they're reading this letter, so they need to know the key information. The key things to highlight are, why did the patient come in? What are the key results? Are there any changes to medicines and why? And any follow-up the patient needs to have. A helpful acronym to remember for this is BOPS. So this stands for bloods, occupational health, physiotherapy, and scans. Other top tips regarding what to include are, does the patient need follow-up? Be specific. Tell the GP when, what, and why. Don't copy and paste PACS results or scan reports in their entirety. The GP doesn't need to have the full report if a CT scan of the head was totally normal. This is a waste of your time and theirs. I'm going to go over a worked example of the discharge summary at the very end of this video, so you get an idea of what to write about in practice. Finally, finishing the letter up. My top tip is read it, make sure it makes sense and you've not missed anything important. Remember that this is a professional document. Also, make sure that the letter is signed and sent to the GP. Sometimes when you've written a draft summary and you save it, it doesn't necessarily send it to the GP until you signed it. Also remember to avoid any jargon. The patient is going to be getting a copy of this letter, so it needs to make sense to them. And finally, make sure that you've included nothing that's going to be of a surprise to the patient. Make sure that you've communicated all of the findings and important results to the patient directly. Now let's take a look at a worked example. This is an example of a mock or draft letter to the GP. I should caveat this by stating that you now write your letters on the online hospital system or digital hospital record rather than freehanding or dictating them. However, if you have space for free text that doesn't auto-populate or you need to freehand your letter, this is an example of what you could write. So at the top, you want to give the patient details. Ensure that these are the correct details. In this case, this is Dorothy Jones. You then want to give the background as to why the patient came into hospital and the final diagnosis. In this case, this lady was admitted on the 2nd of December following an accidental fall at home. She had a confirmed non-displaced fracture of her left neck of femur. Then state what management the patient received and were there any complications during her stay. For example, did she develop pressure sores, a DVT, or did she fall in hospital? These are all important points that the GP might want to know. After you've provided the management, in this case, this lady received surgery using fixation and cannulated screw. She was reviewed in the daily hospital ward round for the next 9 days and her stay was uncomplicated. You then move on to give the GP significant blood test results. Only state the salient results. Do not list every single blood test or copy and paste in all of the labs. This just confuses the GP, and if you have an important message to get across, it can often be lost. If there was an abnormality, state the abnormality, give the value, state how you've managed it. You can then give the frequency and dose of medications. In this case, the lady had hypokalemia, her potassium was low at 3.1, and she was started on oral Sandicate tablets, 2 tablets 3 times a day. We then explicitly stated that all of her other bloods were normal. You then can state medication changes. In this case, this lady has got a further 6 days of prophylactic heparin, and she has a further 5 days of oral Sandicate supply. She has no other medicine changes. You can then move on, finally, to round up with follow-up and discharge requests. I like to start off by stating the specific request you have of the GP, and I put it in bold to make clear they don't miss it. In this case, I want the GP to arrange the bloods to be retaken in 3 days' time to check her potassium levels have returned to normal. I then state important follow-up information that the GP doesn't have to arrange but might want to know. In this case, this lady's been booked into a virtual fracture clinic follow-up in 1 week and an in-person follow-up in 6 weeks. I made sure that the GP knows that this follow-up has been booked and they don't have to necessarily act on it. There are no other requests to state of the GP, and I make this very clear in the letter. I always think it's nice to include a layperson summary for the patient at the end, summarising what happened and what plans are in place. In this case, I give the diagnosis, I state the plans from the occupational therapy and physiotherapy teams, I ask her to keep taking her regular medicines as normal in addition to the Sandicate, and then I made it aware that the GP will be booking a blood test to check her potassium in 3 days. I safety net by stating, if you do not receive an appointment from them, please follow up. I also make sure that if she has any concerns, she contacts her GP or 111, or in an emergency calls 999. I then sign off the letter with my name, my position, and then I leave my contact details at the very end of the letter should the GP need to get in contact with me. So thanks for watching the video. If you found it helpful, remember to like and subscribe to the channel. You can subscribe to the channel by clicking here. It's also really helpful if you write in the comments box below if you've enjoyed the video, if you've got any uncertainties or anything else you'd like me to make a video on. And thanks again for watching. Best of luck in starting any new jobs, and I hope they go well.